I think baseline is correct the gut function, strengthen the absorption, strengthen the function. There's really little point in taking very, very high grade, expensive supplements, etc., if your body isn't able to absorb all those amazing nutrient load. So we need to be really going back to basics and getting the diet a bit more strong. If they do take meat, I always advocate bone broth and probiotic sources, prebiotic, probiotic sources. So yeah, a lot of gut support function, which isn't a way that we can, start from base level. Another key thing is obviously, as I've mentioned, reduce impactful, debilitating things that are going on. So I might make up like a pre-ovulation, a post-ovulation mix, and a pain mix. Some patients, because if they're really feeling that after their ovulation into the luteal, when they shift from their summer into the autumn, if we're talking more from a cyclical menstrual cycle awareness perspective, then that's usually commonly when a lot of identifying women would experience more problems in their cycle. Problems being mood disturbance, real drop in energy, real drop in motivation, feeling levels of sometimes quite high levels of anxiety, like debilitating. So some with PMDD on more extreme acute presentations, but also cramps that are, affecting sleep and heavy bleeding when their cycle actually comes. So yeah, I'm thinking about the herbs and the approaches to help with limiting the impactful presentations. But yes, the immune modulating herbs is very key to my treatment plan approach. I would probably always be putting some nutritive, adaptogenic, lovely medicinal mushroom or maybe ashwagandha or reishi or one of those gorgeous adaptogen herbs as my baseline tonic in most of my prescriptions.
And that's pre and post ovulation in those two different mixes?
Most likely. But when we're thinking about the immune system, what does that mean? Is that they're really flush and they're really hot and they're really then struggling to settle. They've got essentially lots of parasymptomatic excess type symptoms, maybe high blood pressure, maybe heart palpitations, lots of raised hyper conditions. So I'm looking at like draining that to help calm the body, to regulate that nervous system response. And then obviously when our nervous system and our stress is less, our immune system can have a bit of a chance to catch up on itself and maybe not get ill in as many times, and you're supporting the body's immune response with herbs that are helpful for white blood cell increase, stimulating herbs. So I use both the immune stimulating and modulating herbs, I guess, differently.